do you know that had or has leukemia or lymphoma?
My cousin had stage 4 non-Hodgkin's lymphoma about 10 years ago. He has since then been in remission and through various types of treatments, and he actually had a bone marrow transplant. So we are very fortunate that he is in remission and he is still with us.
How did this disease affect your family?
It was a very stressful time because he became so ill and he needed to remain in the hospital for probably a good 6 months receiving treatments. He actually received very high doses where he needed to be in isolation, and it put a huge financial strain on our family because of the huge medical bills, and the medication is so expensive. We decided to do fundraisers and different things like that to make the community aware of the situation and to help offset medical expenses.
Why is Pennies for Patients important to you?
It allows for parents to be with their children, and it helps to alleviate some of the financial responsibilities, giving them, even if it's just for food, for travel expenses, it just helps to give them a little peace of mind while they're going through treatments and things like that.
Thank you.
You're
That has had or has leukemia or lymphoma?
Okay, I knew my dad had hairy cell leukemia, and also, to change it a little bit here, my brother-in-law passed away from leukemia. I'm not sure what type he had, but my dad did survive it. My dad passed away from congestive heart failure 10 years later. But the type of leukemia my father had was called hairy cell leukemia. And if you picture a cell with all these little strands on it like hair, that's why they called it that. It's a very rare form of leukemia. Now it is quite treatable if they find it right away. So that's the good news. Back when my dad had it, well over 10 years ago, there was no treatment except an experimental treatment. And the doctors told us this is either going to cure him or kill him, which was quite scary. But we had no other choice. There was no other option. And fortunately, he did survive it. It was a lot of medication that he had to take in the hospital that killed the bad cells along with some good cells. It was supposed to be a 5-day treatment, and he could only handle 3 days of it. He was quite sick. But he did survive that. And then years later, he died of heart condition. But the hairy cell leukemia was cured. And now the treatment my father had then is the proven way to take care of that. So if you find out you have that now, it's very treatable. Unfortunately, my brother-in-law had a rare type of leukemia as well. He just noticed a pain in his back and like a lump, and he went through a lot of chemotherapy, and we thought he was doing well and in remission, and he fought this battle for over 3 years, and he tried to go back to work, and he went to work for maybe 1 week, and then he just collapsed at work. They had to take him to a special hospital in Philadelphia, like a cancer center in Philadelphia, and he did not survive that. He ended up getting complications from the treatment. And unfortunately, sometimes, like my dad, what they have to use to get rid of the cancer also bothers other areas of use. So he ended up getting pneumonia and was not able to fight off, the problems from that. So it was very sad in both situations. My dad was a happy outcome, but then died years later, not due to the leukemia, but his heart problem. And my poor brother-in-law, Sam, we really thought he was going to conquer it, but he didn't. So it's a horrible disease, and I admire that you're all working hard to try to come up with a cure for it. I have a friend and a cousin who does a bike race every year to raise money for leukemia down in Texas. and it's a devastating thing, cancer and lymphoma.
So how did this disease affect your family?
Well, my father, of course, we were grateful because he survived that part. So that was happy. It was hard to see him going through the treatment, but once that was over with, that was it. He didn't have to have any more treatments. The doctors just checked him every 3 months. So that was a happy thing. We were pleased with that. With my brother-in-law, it was like a roller coaster. He would have good days and bad days, and he just didn't conquer it. And he was such a good fighter, such a fun person. Everyone in the family just loved hanging out with Uncle Sam. That's his name. He was just a lot of fun. He was close to my age, and he died 6 years ago. And it was just really sad. So it certainly affected our family. He was so much fun and just a wonderful person. So it just doesn't seem fair. So it was very hard on all of us.
Yeah. Why is Pennies for Patients important for you?
Well, I think it's great that students are taking an interest in this, knowing it could happen to anyone, young and old, and I think it's wonderful that you're taking this active role in trying to raise money for people that will be needing money to handle these very expensive treatments. So hopefully they'll find a cure, and your part in this might be a big part of that. So that should make you all feel good about that. And I appreciate what you're doing since it touched my family.
Thank you.
You're welcome.
A penny? This is useless. Hey, pennies aren't useless.
Why not?
Pennies are for patients.
Pennies for Patients campaign will run from March 6th through March 26th. Be a hero and help support the Leukemia and Lymphoma Society. The grade with the most money will earn a grade-wide prize, and if the school earns $1,000, the entire student body will be rewarded. So bring in your pennies, nickels, dimes, quarters, and dollars, and put them in your teachers' boxes today.
I understand now.